Welcome to RiverBanks TV, a show that aims to answer your aesthetic questions and introduce you to the wonderful world of RiverBanks Clinic.
We're opening the doors of this beautiful clinic to reveal what's happening inside. We'll meet some people who have had treatments here, as well as look at the trends and treatments that Dr. Ravi Jain, the senior aesthetic physician here, is performing. First, let's take a look at some treatments which have been making the news recently.
Now then, the market for moisturizers, cleansers and lip care is in dazzling shape. Over the past 5 years, sales of women's facial skincare products have grown a healthy 26%. By 2016, it's estimated the market will be worth a whopping £2.4 billion. Olay has a global brand value of almost £206 million. Creams and lotions are important, but what if you want a more effective and immediate solution? That's where dermal fillers and Botox are just amazing. Dermal fillers, for example, have effects that can last up to 2 years and actively fill out deep lines. They work to mimic the skin's production of collagen to plump up and fill out lines or depressions in the skin or hollows in areas such as the cheeks for a fresher, more toned and youthful appearance. This improvement in overall skin surface quality acts to re-elasticate the contours of the face for a non-surgical lift that is highly effective but nonetheless subtle and natural. Amazing.
Now, some celebrities are so obsessed with their body hair that they have to whip it off the moment it pops up. It's reported that Kim Kardashian even had to wax her forehead. But for some people, women with facial hair, for example, it can be a really embarrassing problem. We also love to look silky smooth on the beach, and I find a hairless chest shows off, that's right, my six-pack. At the RiverBanks Clinic, they use the latest laser technology to provide you with effective and pain-free laser hair removal for most skin types and ethnicities. This revolutionary technology really is cutting-edge stuff, and they are confident you will be surprised at how much more comfortable you are. These days, however, hair removal can be painless and highly effective. Good news for Kim then.
Newspapers across the UK reported this month that not only is liposuction the world's most popular cosmetic procedure, but that the UK is a fat removal mecca as patients seeking latest methods flock to London. It seems we have become a society hooked on the easy road to obtaining that celebrity beach body, and some London clinics are reporting a 35% rise in patients requesting the new forms of lipo. Of course, London is not the only place to have these treatments, and in fact, some people actually prefer a more tranquil place to have their treatment done. That's why RiverBanks is a popular place for all forms of liposuction. Located in a leafy, tranquil riverside spot, RiverBanks makes having a treatment a special occasion in all ways. If you are a city lover, of course, RiverBanks also has a clinic in London's infamous Harley Street. At RiverBanks, it's not just traditional liposuction which is popular. You can have vasolipo treatment on just about any part of the body. In fact, anywhere that you have fat deposits. It's equally effective on men and women, and it's safe using a gentle ultrasound process that targets the fat whilst protecting the surrounding tissues. Vasolipo is the modern way to reshape your body, and you'll discover that it will reshape your life too. We've just seen how popular liposuction is in the UK, and also heard about the newer forms of less invasive liposuction, such as Vasa. However, did you know that there were also so-called lunchtime fat reduction procedures, and that some of the newer versions freeze the fat in a pain-free and non-invasive way? Dr. Ravi Jain is the only UK doctor to hold all 4 levels of training in vasolipo, and his clinic also performs fat freezing. So let's see what the difference is between the 2 procedures. Okay, and here we have Chris from Brighton. Chris, hi there. You're comfortable?
I am, yes, thank you.
That's brilliant. Chris, you're going to have a Cool Tech treatment done today. What made you decide for this treatment?
I think it was a couple of things really. It was only 2 years ago I ran a marathon, I go to the gym maybe 2-3 times a week, and you know, eat as well as I can, have a healthy lifestyle. And I turned 40 last year.
Oh
and
dear.
Yes, I know, it's terrible to admit, but I really noticed the difference. And I really noticed that there are stubborn areas of fat that genuinely, no matter how hard I try, I cannot shift them.
Yeah.
I had a personal trainer for a while last year and did sessions twice a week, working on these areas. And you know, somehow another birthday's coming round, and it's only going to get worse.
Now then, from 40 onwards, metabolism changes, and that's quite normal, and it is the same for men and women. Now, you're not exactly the biggest guy around, but you still want to address certain areas.
I do, yes. I live in Brighton as well, so obviously there's a beach lifestyle.
Aha!
Swimming, I would like to go in the sea, and I meet friends on the beach, and you know, somehow, apart from getting older, you know, you don't feel as confident, you don't feel as happy to whip your t-shirt off. And then I read about the Cool Tech treatment, which it just seems like the perfect solution.
Dr. Jane, do explain to us what you're doing today.
Okay, so today we're going to perform a Cool Tech treatment, which involves freezing away the fatty tissue. Okay, we can lose between 20 and 40% of the fat on the treated area in a 60 to 70 minute session.
And which particular area has Chris decided
Chris
upon?
decided that he wants his central abdomen done. Okay, so this is the treatment area.
What is so specific about this treatment? We talked about Vaser and lipo, but this treatment you mentioned earlier on, you can get away with one treatment, possibly only a second one?
Yes, absolutely. I mean, for a start, this is a truly non-surgical treatment. This is a walk-in, walk-out treatment. You see, Chris is, you know, he's just in his regular clothes, taking his top off. We're going to apply a treatment onto him, and within about 70 to 80 minutes, he'll be on his way out, back home, driving home. Whereas the Vaser treatment is a surgical procedure with all that goes with that.
Wow, such a short time, and you're going to be out, walking out of here, and it'll be the new you, Chris.
Yeah, well, it sounds great, and obviously that's what's so attractive about it, that, you know, it could take an hour, and then I'll soon be back on the beach.
Okay, that's not entirely true, okay, or accurate, okay? The treatment will take an hour, but the results may take up to 2 to 3 months to see, okay? So what we've seen is that many patients are quite happy at the 6 to 7 week stage, and they come for a second treatment if they want a bigger improvement. If they're a bit patient, they can wait for 3 to 4 months for even more results, okay? It depends what a patient wants and what their expectation is. Okay?
But the quick fix lies in as much as it is one treatment that's required, not a series of
No,
6
it's
or 8.
1 to 2 treatments in reality. Some people go for a third later on in the year, but I haven't seen any more than that.
Do you think Chris will be in pain?
No, Chris will feel, first of all, he'll feel quite a lot of cold as I apply some cooling gel onto the skin first. Then he'll feel like a tight suction onto his skin, like someone's giving him a big love bite on his tummy. Effectively, that's what it's going to feel. Then his skin will go numb after about 2 minutes, and then he should be quite comfortable. After we take the treatment off, the paddle off, he will then feel a little bit discomfort as I massage the frozen fat away.
Is it like a pulling sensation?
Yes, very much so. Then later on, in the next 2 weeks, some people, about 1 in 5 people, develop some pain which requires paracetamol or painkillers.
So that doesn't require any further, let's say, medical attention other than what you can get at your chemist, and you deal with it yourself.
We wouldn't expect that.
Right, fine.
Yes.
He would not have to revisit the clinic, let's say, in order to deal with that part.
That is not the normal procedure.
Oh, okay.
Yeah. So first of all, I'm going to measure the tissue thickness on Chris's stomach with a caliper. Okay, and with the reading I have on here, I enter it into the machine. And then what I'm going to do is I'm going to apply some cooling gel, and this is a membrane which we apply to the skin, which is absolutely critical to protect the skin from freezing, because we don't want to freeze the skin. What we want to do is freeze the fat. And now we apply the cut. Okay.
How are you doing, Chris? You all right?
Yeah, it's all right actually.
Uh-huh.
It's,
Initial sensation?
it is just like having your skin tugged.
Okay. That's the pull that the doctor was
Yeah,
describing
yeah.
earlier.
So now we've got the suction paddle resting on Chris's stomach. It's actually the vacuum that's securing the paddle to the stomach, okay? And we're at the correct pressures of 2, and the timer's going down, and the temperature of the skin is now going down, and currently we're at 4 degrees, dropping down to 3, and the target temperature will be -8 degrees, and we should be there within a couple of minutes.
And is that why the white tissue is necessary? So
Absolutely, it's to protect the skin, otherwise
Yeah.
the skin will burn. So now we're at -8 degrees Celsius, which is the target temperature for the Cooltech system. This allows us to freeze the fat at the most efficient way and to get the best clinical result for Chris. Okay, so we've come to the end of the treatment. So now I'm going to release the pressure.
You still okay, Chris?
Yeah, really
All right,
good. It hasn't
okay.
hurt at all.
Wow.
Okay, so we're just releasing the vacuum. There we are. And as we can see the area.
Well, well.
As you see, this is now the area which is being sucked in. This is the whole treatment area. So this is the bit, it's not just this bit, we treated the whole area of his lower abdomen. Now this feels quite, have a feel.
No,
what's it feel
it's
like?
frozen.
Yeah, so what's
That's
it feel like?
so bizarre. It feels like a jelly.
Is
a
it
really
uncomfortable?
Ice cold jelly. No.
Is it uncomfortable? No?
This is a complete shock because I didn't even think it was working when
Okay.
it was happening.
Now I'm going to massage the frozen tissue, okay, which might be uncomfortable. And I know this might be difficult,
It kind of tickles.
and you can actually hear the crackling sounds.
That is incredible. You okay?
Yeah, it's fascinating.
What are you trying to achieve
I'm
right now with
breaking
this
down the
movement?
frozen fat.
Right.
So I'm just trying to separate the fat cells and break down the frozen fatty tissue. Okay, so now we've finished the treatment. You've had 70 minutes of fat freezing with the Cooltech, and now all Chris has to do is we just have to give him a clean, put his trousers and top back on, and he's ready to go home.
So that was the Cooltech treatment for Chris. If you have any further questions, don't forget you can email us, tweet us, or send us a message on Facebook. Don't forget there's also the fantastic RiverBanks Clinic app, which you can download at any time. Every week, RiverBanks receives questions from around the world about procedures. If you have a question, then email or tweet in to us. Details will appear at the end of the show. Now, I've got a selection of such questions here for Dr. Jane. Dr. Jane, welcome.
Hello.
Hi there. Mel from Leeds tweeted in, if I have Botox, will I look frozen? Now, that's a concern men and women alike share all over, don't they?
Not if you come to RiverBanks.
Right.
Okay, and that's really key here. Okay, many people do want the frozen look, believe it or not.
Really?
And one of the things I say to them is, we don't do frozen here. Okay, because number one, it doesn't look natural. Okay, number two, it's not in the patient's best interests, because if you freeze the
Absolutely.
muscles for long periods of times, they will lose their bulk. Okay. And then afterwards, they won't look as natural. You know, they may look odd, and you may recruit other muscles, and so increase the chance of other wrinkles developing later. So frozen is not good for you in any way whatsoever, particularly in the muscles and the expressions of positive expression, like smiling and laughing and even looking surprised, you know.
Yes.
If you take away the ability to look cross, actually, so that's typically the frown line between the eyebrows, like mine here, okay? If you take that away, people actually don't notice that so much, okay?
Okay.
Is this, I've heard of something through advertisements, baby Botox. Is that the same thing as just putting less is more? in terms
I
of...
think baby Botox, yeah, it's addressing that fact because previously Botox was about freezing, okay, and this came back from the older style treatments, came back from the US original treatments where they wanted treatments to last for 6 to 7 months, you know, and people would freeze for about 4 of those months and then start to look good the latter half, you know, and what's happening now, you know, because this is something in the UK we've been very aware of, is trying to make sure people look natural at all times and retain some movement, but not enough to cause a wrinkle or a crease. Okay.
It's important for us presenters, Claudia,
No,
to still be
tell
able
me all
to
about
move our
it.
expressions.
Well, you know, you can tell on the TV and watch the certain presenters who's had good Botox and who's had not good Botox and who maybe needs some. You know?
And not just a good night's sleep, isn't it?
Yeah, yeah. But so yeah, that's it. And now the US colleagues are now treating in the same way as the UK are. They're trying to go for a natural look.
Mm-hmm.
Well, we've got another inquiry, and this one's via the website. And someone has asked, how many treatments does it take for my body contouring to work?
Okay.
I suppose it's quite an open question because it could be any types of...
Well, yes,
treatments.
I assume that the person's talking about a non-invasive body contouring treatment, such as the Med Contour or the Cool Tech. Okay, so Med Contour is once a week for 6 weeks, typically on an area. So let's say a tummy or inner thighs or an outer thighs. Okay, Cool Tech typically is between 1 and 2 treatments, 6 to 7 weeks apart. So you could only need 1 treatment to get the result you need. You may need 2, at the very most 3. But so what we find is that people tend to go for the Cool Tech if they are very time restricted.
Yeah.
And then other people tend to go for the Med Contour if they're less time restricted. And then some people go for the combination of both.
It's great that these treatments are out there now that are so... It was the downtime, I think, that bothered a lot of people, and I think it's great to be able to have
Yes,
these
exactly, and for how long they'd be put out.
Yes.
As such, isn't it? Now, we've also had a patient emailing in from London. How can I get rid of blemishes and fine lines on my face?
Okay, so the first thing we need to address there is what's caused these. Is there a family history? Is there a genetic tendency? Is there a history of sun damage when they were younger?
Right.
Do they smoke?
Talking about blemishes now.
Yes, smoking, toxin intake such as alcohol, smoking, poor diet, all of these lifestyle and environmental factors we take into account. Once we've identified any causes, we can then address them. Primarily, a lot of the time it's sun damage. Okay, so a blemish may be a dark area of pigmentation on someone's face. Typically shows up late 30s to early 40s after a sunny holiday and they've never had anything before.
But these days you don't have to go onto a sunny holiday to damage your skin like this. You go into town and that's that.
Well, luckily now we have some weather, yes, exactly. but I think people forget that in their teens they may have been on these sunny holidays and used Hawaiian Tropic, Zero or Oil or 2 and roasted and said, I'll get brown when I go home, you know, and it's that mentality which they're paying for it now, 20 years down the line.
I think we're all guilty of that. I mean, I've been from New Zealand myself, but people now are so aware of the sun because we've got really bad sort of ozone.
But you know, Stephen, to me it's the education of a generation.
Exactly, yeah.
And that's starting to come through now. So how do we treat it? Typically, maybe a combination of some gentle skin peels, which may cause mild peeling for 1 or 2 days, and you can predict so over a weekend maybe. Okay, or you can use a course of IPL Light, which is generally once a month for about between 3 to 5 months, which helps target those blemishes and red veins and redness with no downtime.
Okay.
And then there's the strongest treatment we do, which is called laser skin resurfacing, which addresses most of the signs of sun damage, including tired skin, lack of collagen, dehydration, pigmentation, fine lines, wrinkles. But there is more of a downtime with that.
Would that be traditionally a treatment suitable more for an older patient?
It depends. Not really, because an older patient may need a stronger treatment or a more frequent treatments. Okay. But we can adjust the strength and power and parameters of each. I mean, that's the same for all of our treatments. Every treatment is customized to that patient's skin on the day. The next time they come from, they may have a different parameters. So it's not one treatment, a blanket treatment for everyone, you know.
Now, Dr. Jane, we've got another question. This is actually someone has tweeted in, and they've said they're obviously really interested in laser hair removal, but are really concerned about the risks. Are there extreme risks with laser hair removal?
Laser hair removal is extremely popular, okay? It's become more and more available to people since the deregulation of lasers in this country 2 or 3 years ago now, okay? And this has opened up the doors to many businesses that have opened up lasers in the back of their homes, on any high street shop, and as a result, people are now less trained than they were. They're less qualified to do the treatments. And now we are seeing more and more complications of laser hair removal coming through, such as burning, okay, because it's still a laser, okay, so people are getting burnt. Maybe they're being undertreated, so they're actually getting increased stimulation of hair growth as opposed to cessation of hair growth, okay. And we're also getting striping. Some people have they have strips of hair left behind, okay, so because they've not been correctly treated. So I think the biggest complication, and then there's hyperpigmentation as well. So this is where the skin turns darker once it's been injured, and this is more common in darker skin, such as my skin type or darker.
But this is mainly due to the lack of regulation that
Yeah.
we mentioned before. Who can actually do these types of treatments?
Unthinkable to me. I mean, it's and that you know, as a patient, I wouldn't accept this. I would want a renowned clinic to know what they do. I would want to trust the fact that I need a professional to perform this, and they know what they do.
And men and women have these treatments, I presume, both.
Absolutely. I mean, men go for bodies, you know, chest and shoulders and backs, and some go for the chin, neck
So
areas.
I'm sure the last time I met you, Ravi, you had a pretty hairy chest. Have you?
What are you insinuating? I don't know. Still some there.
I don't know what you're talking about.
Well, keep that to ourselves.
On that
funny.
note, if you want to find out any more information about these treatments, obviously go to the RiverBanks website. You can tweet in, post on Facebook. But thank you very much for your time, and yeah, we'll see you next time.
That's it. Now, we're all keen to learn about new ways and little cheats to looking and feeling great. So I've been looking around RiverBanks Clinic and talking to staff to find out what's going on behind the treatment doors. Dr. Jane, what treatments are the most popular here at RiverBanks?
Without a doubt, our most popular treatment is the Vaser lipo sculpture treatment.
So what is Vaser?
Okay, Vaser is essentially ultrasound assisted liposuction. What does that mean? Okay, because normally when we say to people liposuction, they're afraid and they think of all sorts of gory graphic images and brutality, you know. You know, I need to reassure patients the beauty about the Vaser method of fat removal of lipo is that it's a much gentler form, okay,
Right.
and it's much more precise than traditional forms, okay, and it also offers a quicker recovery, okay.
Right.
That does depend on who's doing it, okay. It's not just the Vaser system allows you to get great results. It's a tool, and it's an artist tool, okay, and you know, we find we get best results using the Vaser system. We have tried various other methods of liposuction, and this one allows us to get the best possible results for our patients.
Does the procedure still involve something which is minimally invasive, where you are having a probe that's inserted rather than something which is it ultrasound that's on top, but then you've got liposuction as well, which is...
Okay, well, you're right, it is a minimally invasive. There will be probes and instruments passed into the body, like in this manner, which they see. But what happens, the ultrasound is passed through a probe into the fat, directly to the fatty tissue, and it lets out an energy which is only absorbed by fatty tissue. So the probe will only work on fatty tissue. It won't work
Incredible.
on blood vessels, it won't work on nerves, it won't work on skin, it won't work on muscles. Okay, so you're only treating the fatty tissue. And what it does, it turns that fatty tissue into liquid. So that when we remove the fat, the vacuum, the power of the vacuum is much less powerful than traditional liposuction, where in the old style of lipo, you had to literally suck the fat off the body.
Wow.
Which is
pretty intense.
quite traumatic. There's
Yeah.
much more blood loss. That is less specific. This way, we can use a gentler suction, and allow, therefore, less damage to the body, and that means a quicker recovery, and it also means you can work in more delicate areas.
Now, there's a lot of other sort of treatments and machines I've seen that are out there which all claim to do probably similar results, but they only tend to work from the outside. And I mean, seeing some of the results, you know, you can achieve some pretty dramatic results, and there's different types of vaser, isn't there? Which different types of forms, like you talk about the 4D vaser, etc. I mean, can you explain a little bit about, you know, the different types of modalities?
Okay, fine. So, as I said, vaser is a ultrasound-assisted form of liposuction. It's an instrument which I use to give the best results. Okay, there's basic vaser, which many people would compare that to traditional lipo with some benefit. Okay, where you may treat a small tummy or a small area of fat, maybe a fistful of fat in an area. Okay, and there's not really too much sculpting associated with that. Then there's advanced levels of vaser where you treat trickier areas such as the chin area, the jowl area, the arms. These are very difficult to get right. Maybe the inner thighs, okay, very difficult to get right. Okay, and you need quite a lot of experience and training for that. And then there came the high definition type of vaser where you'd be looking to create six-packs in people, and this revolutionized liposculpture. You know, this allowed us not only to give athletic-looking bodies to men and women, but it also meant that we could treat slimmer patients. Because before, lipo was traditionally for the fuller patient, not necessarily desperately overweight, but the patient who had a bit more fat to them. And the vaser 4D has taken that high definition work to the next level. I mean, it allows to compensate for dynamic movements of muscles, to help women look even sexier, men look, you know, even trimmer. It's just taken the next level, and it allows you to really look at a patient with a different set of eyes and say, how can I make this patient look the best they can?
There's a bit of controversy over the more sculpting. Someone comes in and, you know, they are pretty toned, but then, you know, you're treating them and then to sculpt those abs. I mean, I suppose there is a little bit of vanity around it, but yeah, I mean, I would love to have a six-pack again. And, you know, when you get to a certain age, you know, you can go to the gym and I'm sure you can achieve a certain amount, but I mean, you've actually had it done, haven't you?
There's no doubt that six-pack surgery is about vanity. Yeah. We don't need to
Could
show
you
off our
overdo
six-packs. Could you overdo it? I mean, in what way? I mean, I think you could get, some people have a 10-pack, for example. They may naturally have that musculature in there, you know? So all we're doing is revealing someone's natural shape. Right. But what's important to separate here is that women don't tend to go for the six-pack, okay? Because that doesn't look very sexy or very feminine for most females, okay? We tend to do what's the twin pack for the females, and we give them a very sexy waistline. We give them the nice midline muscles, so down the middle here, down the side, so they have that sexy lines of definition, okay? Which makes them feel so confident. You know, they come for their 8-week check and they've got figure-hugging clothes. You know, they've already booked their holiday, you know, where they're going to be in their bikini, okay? And the men just love the fact, because they work out even more afterwards, because they now don't mind going to the gym with tighter clothing on, because, you know,
it's like giving a head start almost, isn't it?
Yeah, exactly. I mean, that's how I say to my patients. I say to them, you know, the six-pack surgery, lipo, what we're going to do for you, imagine you're in the Olympic meters final, okay, and you've got Usain Bolt next to you, okay, and we're going to put you on the 90-meter line, okay? You got to beat him still. Now, if you stand still and do nothing, he's still going to beat you, okay? You've just got to do that extra bit. So we're giving you a massive head start to get to where you want to go to.
And now, Dr. Jane, you are the only doctor in the UK who is able to operate all 4 levels of vaser.
That's right. Training is really key to me. I want to make sure I offer them patients our best possible work as well. I want to give them the best results, okay? And I've been to various specialists around the world to make sure I get the experience required to do this specific type of liposuction, and it is highly specialised. It's not to be confused with regular lipo in any way. And it's a passion for me, and I, and I'll always, when the next level comes out, I'll be on that
You'll be
course.
on that one. Now, is it a situation like you're standing in front of the patient, talking about it as an artistic tool, and you feel a bit like Leonardo da Vinci, and right, let's start, and would you like this, and would you like that? Does it inspire you with the knowledge that you have of what you can create and the power that this brings?
I love it. I mean, it's so exciting to be able to, to see someone where you know that you're going to be able to give them an amazing shape.
Yeah.
And, in the operating theatre, we the patient's shape is our canvas, effectively, and then at the end of it, when we get to the shape we want, it's not just me who has to judge, it's my assistants who will say, yes, this is right, or no, you've missed a bit here, go back there. Even the anaesthetist is checking that we've all got to the level that everybody's happy with, and it's only when we're all happy that we end, and we're, hopefully we're confident that the patient's...
Well, I mean, the results look amazing, and I think, there's so much great information out there on your website. I think if you are looking to have a treatment like Vaser, it's really important to book in for a consultation and find out what's going to be best for you.
Absolutely.
So thank you very much for your time, and as I say, tweet in, get your posts in, and let Dr. Jane give you his insight.
At the heart of every treatment is a patient story. And joining me now is Jackie to tell us what hers is. Jackie, welcome to RiverBanks TV. Now, tell us, why did you come to RiverBanks Clinic and which treatment did you have done?
I had Vaser lipo and I came to get some treatment from a previous year corrected.
Oh, I see. So actually you had a treatment done and you weren't happy with the result?
No, I'd not had Vaser, I'd had the same sort of thing, but it had gone quite wrong. So I came to Ravi to see if he could fix.
And how was the procedure here for you?
Yeah, great. Ravi's very honest. In fact, he's really honest, because I wanted a lot more than he would actually let me have. So, yeah, he was good.
Okay. And during the treatment, what was it like? Did you feel any pain or was it uncomfortable?
I felt nothing during the treatment because I wasn't aware of anything that had happened. So, first day, yeah, it was painful. Second day, not so painful. Quite a lot of swelling, that's quite heart-wrenching at times. You think, what have I done? But 2 weeks, the best thing I ever did.
And are you happy with the result of the treatment
Shorts
now?
and dresses now, so yes.
Oh, wow.
Yes.
Your partner, happy with the result as well?
I think he's happy that I'm happy. He loved me no matter what, so yeah. If I've got great knees and that's focusing, it's good.
It's good. And of course, shorter skirts and dresses, that must have done... That must have done a lot to improve your confidence.
My friends have noticed, but they've noticed that I wear dresses, not that I've had my legs done. So that was a good thing.
And that's usually the best sign when you don't see anything, but it just looks bright, good, healthy and actually beautiful.
They'd never seen what had gone wrong because I wouldn't show. They're just so aware that now I, the girl who never wears dresses, will wear a dress.
Well, I'm thrilled for you, Jackie. Thank you very much for coming in today. Thanks.
I'm here with Stephen Davis, who's a patient at the RiverBanks Clinic, who's had the Cooltech and some IPL treatments. Now, welcome to the show, Stephen.
Thank you.
Just want to start off with the Cooltech treatment. Can you tell us a little bit about your experience? Why did you think about having this treatment in the first place?
Well, I think one of the problems with diets and gym is that you look at your body and it doesn't actually lose the weight in particular areas that you want. And I decided that I was getting a little bit of fat that I didn't want.
We all get it.
Yeah, and finding it very difficult to get rid of.
Yeah.
Ravi explained to me the treatment, and I thought, well, that sounds cool.
And what interests you a lot about this Cooltech? Because it's freezing the fat. It's something quite different and quite innovative, isn't it?
Yeah, I think it is, but I think the research that I was shown and told about was logical. It seemed less invasive. There was nothing to be cut. There was nothing to be taken away. It just froze it away, which seemed to me.
Now, most of us men are always worried about the pain factor. I mean, was it painful? Was it?
No, I didn't think it was painful at all. In fact, on both occasions, I went back to work the minute I left RiverBanks, and there was a slight discomfort perhaps over the next couple of days, but nothing more than really you would find with muscle pain having gone to the gym.
So how long is it now since you've had your last treatment?
About 2 months.
About 2 months. And how are you feeling? What's the difference that you've...
Oh, I'm looking in the mirror thinking, oh, that looks better. And with the exercise and with a slightly better diet, it really has improved it. And instead of having a fold of fat, it's now smoother. So I should be coming back for more, I guess.
Well, you did say that you were off to the swimming pool after this, so obviously you've got your confidence to get those Speedos on and by the swimming pool.
Oh, sure, yeah.
So, I mean, the other treatments that you've had is these IPL treatments for the for the face. I mean, why did you ask Ravi to look at having those types of treatments?
Okay, again, it's part of wanting to look good, but I'm a business speaker and I do broadcasts now and again, and I, as a child, had noticed my family having thread veins in the cheeks, which I thought, even as a child, were very unpleasant, very sort of scarring. And I just hoped when I was a kid that I never got any. And I got to a certain age and they started to appear. And I wanted to get rid of them. I was very conscious of them every time I stood up in front of an audience, that the audience were concentrating on that aspect of my face rather than what I was saying.
So how did Dr. Jane deal with this, with your consultation? Did he, what types of treatments did you undertake?
Well, I had a laser treatment, and I was kind of, you talk about lasers, and it's kind of very scary, and you imagine Star Wars technology, melting your face, but actually that's not the case. And he went through what it would be like, and actually it would be rather like sort of a slight sort of sting on the cheek, and over the next 2 or 3 months the veins would disappear. And they did. And
fantastic.
I've come back twice and absolutely fantastic. And I feel so much more confident that's the difference.
And have friends and family noticed difference at functions and family get-togethers? Have they noticed any change?
Well, they don't actually. They just look at you strangely and say, "Aren't you looking well?" That's as good a
well, I think we always love to hear about these success stories. So it's really a pleasure having you here to tell us all about your experience. So thank you very much.
Well, thanks for inviting me.
Well, that's all we've got time for today. Thanks for watching.
So if you still got any question or would like more information about the treatments featured, don't forget you can email or contact us on Twitter and on Facebook.